Everyone, and welcome to Access and Functional Needs Assistance in Mass Care Settings. We hope that you will find today's instruction beneficial. This is a very important topic when it comes to sheltering and other mass care settings. On any given day, approximately half of the U.S. population has a temporary or a permanent condition, diagnosed or undiagnosed, that limits their ability to take action in an emergency. These conditions are referred to as access and functional needs. Not only that, but disasters disproportionately affect the vulnerable members of our society. And those with disabilities or special health care needs have even been overlooked, faced a lack of available resources, or been denied resources in a disaster. So here's a case in point. Melba Torres. As you can see, she uses a motorized wheelchair because she has cerebral palsy. And as a result of Hurricane Irene, she spent 36 hours in a shelter that lacked accessible amenities. The restrooms were not accessible, so she actually had to be carried in and out whenever she needed to use the restroom. The cots provided were also not accessible, so she slept sitting upright in her motorized wheelchair. At other shelters, people with wheelchairs couldn't even get in because of problems with ramps. The ramps were either too steep or they led to doors that were locked and the volunteers didn't have a key, or there were no ramps at all. So our overall course goal today is to promote a general awareness for you of what access and functional needs are, and how to recognize and respond to the AFN population in mass care settings. At the end of this course, you should be able to discuss AFN key terms, definitions, and empowering language, recognize the legal foundations and their implications during emergencies, describe types of access and functional needs and best practices for assisting individuals who have them, and identify available toolkits and resources to learn more about access and functional needs. So we're going to start by talking about terms and language and some legal aspects of this particular topic. So persons with access and functional needs are those individuals with needs related to a restriction or limited ability to perform activities normally considered routine. As such, these people may require assistance before, during, and or after a disaster or emergency. You'll notice here that the largest circle in the graphic represents the entire population. The next largest circle represents those with access and functional needs, and the smallest circle, those with disabilities. So disabilities are a subset of AFN. As defined by the ADA, disabilities are physical and mental impairments that substantially limit at least one major life activity, such as seeing, hearing, mobility, cognition, and things of that nature. Within the AFN community, there's actually some overlap. Some have just access needs, others just functional needs, but it is possible to have both access and functional needs, such as someone who needs glasses and or large print text to read. That's an access need. And they also use a walker to help provide balance and stability when they're standing or walking. That's a functional need. It's also important to remember that you do not need a formal evaluation or diagnosis to be considered to have an AFN. All right, so let's talk about the term AFN, access and functional needs. This phrase, we're shifting away from some of the other phrases that you see on the screen here. They're really too broad and therefore are not really productive, and some of them are offensive. to the population that we're talking about. So the term access and functional needs shifts the focus. It's not about their diagnosis and labeling. Instead, the focus is on planning for and providing services for and addressing the needs that result from the person's condition or situation. So it's a paradigm shift. So let's talk a little bit about use of appropriate language. Life for most people with mental or physical disabilities has vastly improved over the past 40 years. However, some things have been slow to change. Among them are attitudes and perceptions about people with disabilities. The use of outdated language and words to describe people with disabilities contributes to perpetuating these old stereotypes. And if public opinion about people with disabilities is to evolve, then awareness and usage of more appropriate language needs to become part of our everyday conversations. So a couple of examples: do not refer to a person's disability unless it is relevant to the situation or discussion. The use of the word handicap is now considered offensive, and the preferred term is disability. Generally, it's only acceptable to use handicap when you're referring to accommodations such as handicap parking, although accessible parking is actually preferred today. Don't say a disabled person, say a person with a disability. This emphasizes that individuals with disabilities are people first and thus should not be defined by their disability. Don't use the phrase suffers from or a victim of, afflicted with, etc. These portrayals elicit unwanted sympathy or worse, pity towards individuals with disabilities. On the flip side of that coin, don't portray people with disabilities as overly courageous, brave, special, or superhuman just because they've overcome a disability. Doing so implies that it's unusual for people with disabilities to have talents, skills, and the ability to contribute to society. And lastly, never say wheelchair bound or confined to a wheelchair. People use mobility and adaptive equipment like wheelchairs as tools of greater independence. So the words bound and confined are counterintuitive. So making adjustments to how we interact with the AFN community isn't just about their preferences, although they are very important. Here is a list of the laws, regulations, and authority for providing the AFN population with the services they need in an emergency mass care setting. Just to highlight a few, the Stafford Act and Post-Katrina Emergency Management Reform Act, along with the federal civil rights laws, actually mandate integration and equal opportunity for people with disabilities in general population shelters and other mass care situations. In addition to laws and that sort of thing, lawsuits can also shape the way access and functional needs are addressed in mass care settings. But rather than have to keep track of all of those laws and lawsuits and that sort of thing, just remember this bottom line: provide reasonable accommodation and make every effort to be inclusive in our assistance to the citizens we serve in our mass care settings. That is the bottom line. So a quick knowledge check. What are some appropriate language tips to use or avoid? I'm going to pause just for a minute to give you a chance to think about some of the ones you might remember, and then I'll chime in with a refresher for you. Okay, so hopefully some of the things that you recalled were to be mindful of disability relevance, not mentioning the disability unless it's relevant to the situation or discussion. Use of the word disability versus handicapped. Use people first language, saying a person with a disability rather than a disabled person. Avoiding negative or sensational language such as a victim of or afflicted with. And also on the flip side of that coin, avoiding gratuitous praise. And last but not least, resist the use of bound or confined regarding wheelchairs. And another quick question for you to think about for a few seconds before I give the answer. What is the bottom line for addressing AFN? So hopefully you were able to recall that our bottom line is that we provide reasonable accommodation and make every effort to be inclusive in assistance to citizens in a shelter situation.
We previously mentioned that about half of the U.S. population has an AFN on any given day. To put that into more context, that includes children, people who live in institutional settings, older adults, pregnant women, people with disabilities and chronic conditions, people with pharmacological dependencies and limited access to transportation, limited English proficiency and non-English speakers, people with social and economic limitations, and individuals experiencing homelessness. In other words, someone you know right now, it may even be you, has an AFN. Before you get overwhelmed by the possibilities, please remember that there are local, regional resources available through disability advocacy centers and programs. One such program is the Centers for Independent Living, which has offices throughout the state. There may also be other programs within your area. These programs may be a resource to assist with shelter planning and may also help support particular AFN needs that can't be met directly within the shelter. Your job is to help identify needs, meet them when you can, and connect residents with other AFN resources when you can't. So how do you identify AFN in a shelter situation? Many shelters use Red Cross registration forms or a similar type of form, which asks some questions to help identify AFN needs. The Red Cross shelter registration form includes cues to observe and questions to ask, including observing if the client has a service animal, uses a wheelchair or walker, or demonstrates any other circumstance where it may appear that they need help in the shelter. Or asking, is there anything you or a member of your family needs right now to stay healthy while in the shelter? And do you or your family have any health, mental health, disability, or other condition about which you're concerned today? If they answer yes to any of these questions, identify what assistance is needed. If their need is one you can meet, such as moving furniture around to accommodate a mobility issue, or locating their cot near an accessible restroom, by all means do so. If you're unable to meet their need, you may need to connect them with health services or mental health services that are available on site, or contact a local advocacy center or program to request assistance for other types of support needs. People may not identify any needs at registration, but as time passes in the shelter, you might notice a particular resident or family trying to deal with an AFN. Or during the course of talking with them, they may share additional information. If this happens, again, help them when you can, or recommend they talk to health services, mental health services, or reach out to an advocacy group or program, depending on their need. And remember that if you mistakenly refer them to the incorrect service area, the area will direct them to the appropriate one. It's important to remember that most people with AFN and disabilities are fairly independent in their daily lives. While sheltering is difficult for everyone, changes to the normal environment, routine, and support system may be a little more difficult for some individuals to handle on their own. Thus, they may need some support in the shelter. While it may sometimes be easy, especially when you're busy, to direct AFN and disability needs to other resources, such as health services, this may not always be appropriate. Sometimes people want to medicalize these individuals. However, most of the people you will see are not going to require medical support. Also, you don't want to overwhelm your health staff with unnecessary referrals. Most of the time, people can stay within the general shelter dormitory area and won't need to be housed in the medical area. They may consult with health services as needed for minor questions and concerns. In the next module, we're going to discuss how to work with different types of access and functional needs in mass care settings. One of the most common AFN needs that you'll likely see will be people with limited or no English proficiencies. And there are several ways that you might communicate with these folks. Your shelter might use one or more of these types of resources, such as pictogram cards. These have pictures on them, and you and the person that you're communicating with can point to those pictures in order to exchange basic information, ask questions, and respond to one another. Or language cards, which can help you determine what language they are speaking so that you can get the correct interpretation service. Be sure that you know how to contact and use telephonic language interpretation services. Typically, local social services, public health, and law enforcement, among others, have access to telephonic interpretation services. Be sure not to use children as interpreters. They may not know how to translate some of the topics being discussed. Also, you don't want to use other individuals who are unrelated to the resident you are trying to communicate with, because doing so poses a privacy problem. Finally, steer clear of using Google Translate. That is not a reliable translation service. If you notice a lot of people coming in who speak a certain language, suggest getting signs in that language and perhaps even an on-site interpreter. When using an interpreter, remember to make sure that you look at the person you're talking to and not at the interpreter while you're communicating. There's a difference between hard of hearing and deaf. People who are hearing impaired vary in the extent of hearing loss they experience. Some are completely deaf, while others can hear some sounds with hearing aids. But remember, hearing aids do not guarantee that the person can hear and understand speech. They increase overall volume, not necessarily the clarity of spoken words. So here's some tips for how you can work with them. Let the person take the lead in establishing the communication mode, such as normal speech, sign language, or writing notes. Keep in mind that not all people who are deaf know sign language. Use facial expressions and hand gestures as well as visual cues. This may be a challenge during a public health emergency if people are wearing masks, but do the best that you can. Speak slowly and clearly, but don't over-enunciate. Check to see if you've been understood, and if not, repeat and rephrase if necessary. Written communication will work for many people who are deaf and may be especially important if you are unable to understand what the person is saying. If you feel that an American Sign Language interpreter is needed, consult with your shelter manager and your local advocacy service or program for resources. And again, remember that if an interpreter is present, keep your eye contact with the individual, not with the interpreter. When working with an individual who has a speech disability, pay attention, be patient, and wait for the person to complete a word or thought. Do not finish their sentences for them. Ask the person to repeat what is said if you don't understand. Tell the person what you've heard and see if it's close to what he or she is saying. And consider written communication as an alternative. Be prepared for people who use assistive technology to enhance or augment speech. And don't be afraid to communicate with someone who uses an alphabet board or a computer as their primary communication tool. When working with seniors, start by telling them who you are and what you're there to do. In fact, this is a best practice for working with everyone in the shelter. Always ask the person how you can best assist them. Some elderly individuals may respond more slowly in a crisis and may not fully understand the extent of the emergency. Repeat questions and answers if necessary. Speak slowly, using short words in a calm voice. Ask yes or no questions and repeat them if necessary, and maintain eye contact. Be patient. Taking time to listen carefully or to explain again may actually take less time than dealing with a confused person who may be less willing to cooperate. Seniors with a hearing loss may appear disoriented and confused when all that's really wrong is that they can't actually hear you. Determine if the person has a hearing aid, and if they do, is it available and working? If it isn't, do they need a new battery to make it work? If so, contact your manager and see if there's any resources available for that. If you need to guide them, let the person hold your arm if they want to, but don't force them to. Before the evacuees even arrive at the shelter, begin anticipating that you will serve people with mobility impairments. Set up your furniture, including the registration tables, cots, etc., with at least 3 feet of space around them to allow wheelchairs and walkers plenty of space to maneuver. Also, as time goes by, make sure to keep those spaces clear to ensure continued access. When addressing someone with a mobility impairment, always ask them how you can help before beginning any assistance. Respect their independence as much as possible and don't assume what they can and cannot do. For those using wheelchairs, sit or kneel so that you can be at their eye level. Don't push, lean on, or hold on to a person's wheelchair or walker unless the person asks you to, because these items are part of the user's personal space. Know ahead of time where the accessible bathrooms and water fountains are at your site and share that information with them. So that would be information you would get when you show up for your shift and do your first walkthrough. Make note of those items at that time. If for some reason they don't have their assistive device with them, consult your local advocacy program to inquire about a temporary replacement. There's a difference between visual impairment and blindness. Some people who are legally blind have some sight, while others are, in fact, totally blind. Again, set up and maintain access with these folks in mind using the 3 feet of space around furniture rule. Be sure to announce yourself as you approach them and identify yourself and others who are present. Speak naturally and directly to the individual and don't shout. Don't be afraid to use words like see, look, or blind. Offer assistance, but let the person explain what help they actually need. Remember that you'll need to communicate any written information orally. If you need to guide them, it's called wayfinding. So let the person grasp your arm or shoulder lightly. They may walk slightly behind you as shown in this picture. This helps them to gauge your body's reactions to various obstacles. Be sure to mention curbs, steps, doorways, narrow passages, ramps, or any other obstacles before you come to them. When guiding someone to a seat, place the person's hand on the piece of furniture. As you depart their area, be sure to excuse yourself so that they know you're walking away. Okay, so let's do a couple of quick scenarios to help connect the material we've presented so far. This is a registration table at a shelter. Based on the access and functional needs we've discussed thus far, do you see any problems with the way it is set up? I'm going to give you a moment to think about it and jot down some notes, and then we'll discuss it. Okay, how did you do? Here's some of the things that I notice when I look at this picture. There isn't 3 feet of space between the table and the lockers on the opposite wall. The narrow aisle, due to the angle of the registration table, could present challenges for people with mobility and visual impairments. The mechanical lift on the right wall presents a potential obstacle for a person who's blind or visually impaired. The crowded hallway could present challenges for people with mobility issues. There are no chairs for people who may not be able to tolerate standing for any length of time. And the crowding and noise in the hallway may make it difficult for people with hearing impairments to hear the ladies at the registration table. Similarly, it may make it difficult for the ladies at the table to hear and understand people with speech impairments. Let's try another one. Let's look at Gabby's situation. She's come to the registration table at a family assistance center, but you're having difficulty understanding her because she has a disability that affects her speech. What are some techniques you might use to work with her? Let's take a moment for you to jot some notes, and then we'll come back. Okay, so some things that you could do to help Gabby are to pay attention and be patient with her. Ask her to repeat anything that you don't understand. Tell her what you've heard and ask for clarification if needed. Offer her a paper and pencil, and be open to using any assistive technology that she might have with her. If Gabby doesn't speak English at all, you could use language cards to determine what language she's speaking. Be aware of anybody on the team who may be fluent in her language. Be aware of the process for telephonic language interpretation services. And remember to avoid using children, unrelated adults, or Google Translate for interpretation services. All right, cognitive impairments could include Alzheimer's, traumatic brain injury, autism, and many other types of issues. It may be difficult to know whether someone has a cognitive impairment. Some people don't exhibit any obvious signs, but some of the behaviors they may exhibit include, among other things, looking or acting confused, requiring more time to process what you are saying and to respond to you. They might have trouble with motor skills or balance. The person might not adhere to social norms about how to dress, the appropriate amount of personal space, making eye contact, and similar types of things. Or they may exhibit obsessive or repetitive behaviors or fixation on a topic or object. The overall recommendations for working with individuals with cognitive impairments include exercising patience, using plain, simple language, and repeating things as necessary. Getting your fellow shelter specialist to work with you if needed. Offering use of the quiet room to help adjust to the shelter environment. This may help them to feel less overwhelmed. If needed, you could offer your arm to help with balance, but you should avoid touching them without permission. There's no reason not to allow unusual behaviors unless they're a danger to themselves or others, in which case you would notify security. If they need but do not have a caregiver with them, connect them with the behavioral health services and work with them in your local advocacy program to see what support could be provided. You may not be able to tell if a person has a mental health issue until you have time to observe and interact with them, or unless they self-identify. So you may never know. But here are some things you might want to watch for and do. They may begin to exhibit unusual behavior. They can be fine one minute and not the next. In an emergency or unfamiliar situation, the person may become confused, or they may become agitated or even delusional. In the presence of any of these behaviors, remain calm and reassuring. Let them know that you're there to help. If the person is agitated or delusional, bring in behavioral health services. But if at any point they become a danger to themselves or others, call security. Okay, so here's a couple more scenarios to test your knowledge. Carla appears to have a cognitive impairment based on some of her behaviors. What techniques could you employ to work with her? I'll give you a moment to think about that. Some of the techniques that you could use to assist Carla are being patient, asking a team member to assist you if you need additional assistance, escorting Carla to a quieter environment, offering your arm if needed, but waiting for permission, or allowing behaviors unless there's a risk to self or others. You could refer her to behavioral health if she needs but does not have a caregiver with her. And you would work with them in your local advocacy program to see what other support could be provided. John has confided in you that he has a mental illness. What techniques could you use to work with him? Take a moment and we'll come back and discuss. Similar to Carla, you can remain calm and reassuring for him and let him know that you're there to help. If he becomes agitated or delusional, bring in behavioral health services. If at any point he becomes a danger to himself or others, call security. Now we're going to talk a little bit about service animals. Some people with disabilities use service animals, and the correct ADA definition of a service animal is a dog or miniature horse that has been individually trained to do work or perform tasks for people with disabilities. Some examples of the scope of work or tasks a service animal may be trained to do are detecting high or low blood sugar for people with diabetes and guiding people who are blind or visually impaired. Therapy animals and animals whose sole function is to provide comfort or emotional support do not qualify as service animals under the ADA. When registering someone with a service animal, there are only two questions that you can legally ask. The first is the animal required because of a disability? And if they say yes, you may ask, what work or task has the animal been trained to do? You may not ask what the person's disability is or require medical documentation. You may not ask for demonstration of the animal's ability. The animal does not have to wear a vest or any other kind of service animal certification. If the person correctly answers those two questions, then you must treat the animal as a service animal and keep it with the owner, who is responsible for watching the animal and addressing its feeding and toileting needs. The ADA requires that a service animal be under the control of the handler at all times. Under control means harnessed, leashed, or tethered, unless this interferes with the animal's ability to perform its tasks, or unless the person's disability prevents them from using physical controls, in which case the person should be able to use voice commands, a signal, or some other means of effectively maintaining control. Under control also includes not barking repeatedly for dogs. If the service animal is not under control and the handler doesn't effectively bring it under control, or if the animal is not housebroken, notify your manager. The animal may be removed from the shelter under those circumstances. Sometimes people know how to give the right answers to those two questions we talked about in order to keep what are in actuality their pets with them. But the bottom line here is that it's better to allow what's really just a pet into the facility than to potentially deprive someone of their service animal. Remember that service animals are working. They are not pets. Do not pet or otherwise distract them from doing their job. They're allowed anywhere in the shelter as long as the handler is with them. If the person with the service animal comes in with other members of the family, it could be that more than one person in the family is trained as a handler for the animal. In cases where another resident or a staff member is either afraid of or has allergies to the animal, work out a way to keep them as far apart as possible. You can't segregate the person with the service animal to a different area of the shelter. Not everyone is familiar with all these details about service animals, so you may have to educate others as you observe opportunities to do so. Time for a short case study. Bob comes to the shelter with his dog, which he says is a service animal. What are the two questions that you can ask him? The two questions are, is the animal required due to a disability? And if he says yes, what work or task is the animal trained to do? If another resident is concerned about sharing space with the service animal, be sure to separate the two residents as much as possible within the dormitory. And remember, not everyone knows about service animals, so you may have to do some education with other shelter residents. If the animal is out of control, be sure to notify your manager and security immediately. Service animals that can't be controlled may be removed from the shelter. For bonus points, what does under control mean? Under control means the animal should be harnessed, leashed, or tethered, or effectively controlled with voice, signals, or other means. If the animal is a dog, it should not bark repeatedly. So as the saying goes, the best defense is a good offense. Use these customer service tips to help you work effectively with everyone you meet in a mass care response operation. Start by introducing yourself and stating what you do. Exercise your patience muscle. Stay positive and treat everyone with the dignity and respect you would expect to be treated with. Be empathetic as necessary, and pay attention and be intentional in your interactions. Always offer help and ask what help is needed. Meet the needs when you can and ask for help from your fellow service providers and/or manager if you can't. Whether we identify as having an AFN or disability or not, everyone deserves and benefits from good customer service. And remember, a smile is always the right thing to do. We all make mistakes, so relax. If you forget some courtesy, offer a sincere apology and move on. Time for a knowledge check. The service animal handler asks you to take the dog out for a bathroom break. What do you do? Remember that it is the handler's responsibility to care for their service animal. It is not staff's responsibility to do that. As we get ready to wrap up, think of all you've learned today and name at least one new thing that you've learned about interacting with individuals with AFN.
Okay, so we're nearing the home stretch here. We'd like to show you some resources that we've gathered in hopes that if you would like to do additional research into this topic, you know where to start your search. The U.S. Department of Labor Communicating About and with People with Disabilities, we found to be a helpful document. Emergency Shelter Training, Assisting People with Disabilities, Access and Functional Needs, is a 12-minute YouTube video. Disability Awareness Training is another video. ADA Requirements Regarding Service Animals is the document from which we pulled the information for this presentation. Then FEMA has a course, including people with disabilities and others with access and functional needs in disaster operations. That is a 2-hour online course. And we thought that this course might spur you to think about your own or your loved ones' AFN or disabilities and how they could prepare for an emergency situation. So we included some guidance on that as well, preparedness for people with disabilities. And then there's an interesting 12-minute video there at the bottom, Guess My Disability. So a quick review of what you should now be able to do that the course is at its close. Discuss AFN key terms, definitions, and empowering language. Recognize the legal foundations and their implications during emergencies. Describe types of access and functional needs and best practices for assisting individuals with AFN. Identify available toolkits and resources to learn more about access and functional needs. Real quick, here are the references for some of the items that we quoted. Again, the service animal document from ADA, as well as planning considerations for persons with access and functional needs in a disaster. Thank you so much for your time and attention in taking this class. If you have any questions or need any kind of assistance, please contact oem@dss.virginia.gov. Thanks again and happy sheltering.